physical assessment, first I'll start by sanitizing my equipment, which includes my stethoscope as well as my reflex hammer. Then I'll be making sure that I do the Snellen chart exam on my patient, which is 20 out of 20 uncorrected. Then I will be taking the vitals, which starts by temperature 98.6, then it will be pulse 80, respiration rate 18, and then it will end off by BP 120 over 80. Lastly, I'll give introductions and ask my patient for consent. So hi, my name is Priscilla. I'll be your nurse today. I'll be doing a physical assessment on you, and that does require me to touch you. Is that okay? Patient said okay. Then I will do my hand sanitizing and give my patient privacy. Then I will start my initial exam. So I'll ask the patient, what's your name and date of birth? Okay, they answered correctly according to their band. Then I will be asking them about their pain. Are you in any pain? Can you rate it from 0 to 10? Patient says 0, but if they rated pain above 0, then I would do OCART and ice. Do you have any allergies? Any medicinal allergies? Any environmental allergies? The patient said no. So now I can continue with my orientation exam. So patient, do you know where you are? Do you know why you're here? Patient already knows their name and date of birth, so they are oriented ×4. Now I'll be checking their mood and general well-being. So I'll ask them, how have you been feeling these days? Is this similar to how you've been feeling for the past month? How about the past year? So yes, they told me how their mood is and they said it's normal. Now I'll be finding I'll be assessing their skin, and their skin is tan and it's equal in texture as well as in color. The patient is well groomed, and they also don't have any tattoos or piercings. Their temperature is warm and moist, and it seems adequate. Now I'll be checking their skin turgor on their clavicle, and there seems to be no tenting, so hydration is there. Ear assessment, I'll be using my light pen. There is no exudate, there is no inflammation. There is no exudate or inflammation on the left ear as well. Findings are normal. Now I'll be looking at the mouth using my pen light and a tongue depressor. I say ah, say ah. Their uvula is midline, and their tonsils are graded at a 2+, which is normal. Their mouth is moist and pink, and they also have, I will also test for their tongue movements. So I will ask them to go testing their tongue movements. Next, I'll move on to my lymph nodes. So I'll be checking the pre-auricular lymph nodes. They should not be palpable, any of them. Post-auricular lymph nodes, occipital. Then I'll be checking their tonsillar. Then I'll be checking their submaxillary. Then I'll be checking their submental. Then I'll be checking their anterior cervical chain, their posterior cervical chain, and lastly, I'll be checking their supraclavicular. So none of them are palpable, which is normal. Next, I'll be checking the carotid, which I have to auscultate for. So I'll be auscultating for the carotid using the bell of my stethoscope. So both sides don't have any bruits. Now I'll be palpating. So it is at a +2, and now I'll be, which is normal. Now I'll be comparing it to the radial pulse. It is even and equal, and it is the same. Now I'll be checking for JVD. So the patient is lying, sitting up front, and there is no JVD present. Now I'll be putting them in a 45-degree angle. Checking the JVD, there is none. And if it's above 3 centimeters, then it is abnormal finding, but there is none. Next, I'll be checking for the olfactory. I have 2 smells over here. I'll be occluding the left nostril, asking them to smell. They smell coffee, which is accurate. Next, I'll be occluding the right. On the left nostril, they smell coffee, which is accurate. Now I'll be checking for eyes and Perla, which I have to use. So now I'll look at her Perla, which checks cranial nerve 3, 4, and 6. So, sorry, I'm gonna do it one more time. So Perla is present and it is round and reactive to light. Now I'll be checking the cardinal field of gaze using the H method. Follow my pen, please. There is no nystagmus present, and now I'll be checking for accommodation. Look at my pen, now look at my hand. Look back at the pen. Convergence is there, so accommodation is there. Now I'll be checking for facial nerves, cranial number 7. I'll be asking them to puff their cheeks, smile, frown, raise their eyebrows. Facial symmetry is there, which is normal. Whisper and Romberg test are next. So I will be whispering into the right ear, "It's hot today." And the patient was able to repeat it. "It's an awesome day." And the patient was able to repeat it. And that tests cranial nerve number 8. Now I'll be doing tongue movements, which tests cranial nerve number 9, 10, and 12. So I'll be asking the patient to say ah. I'll be using a tongue depressor. The uvula is midline. I'll be asking them to stick their tongue out and move it side to side. And then move it up and down. That shows normal findings. Next, I'll be testing the trapezius muscle. And this is the shrugging motion. I'll be standing behind them, asking them to shrug. The finding is normal because they can do it against resistance. Next, I'll be checking the sternocleidomastoid. I'll be using resistance. Can you turn to the left? Your neck. Can you turn your head to the right? They can do it against resistance, so that is a normal finding. Next, I'll be testing gait. Can you stand up for me, please? Can you take your legs and walk heel to toe? Patient is able to do that 5 steps forward, and that is a normal finding. I'll be doing the upper cerebellar test now. Can you please touch your thumb to every fingertip, like so? That tests the upper cerebellar movement, and the patient was able to do so. Lower cerebellar movement requires the patient to touch their shin to their leg. Can you do that for me? The patient is able to do that without any difficulty. Now I'll be moving on to the chest and arms. First, I already assessed skin turgor, so I'll be moving on to skin temperature, which is already a normal finding. Then I'll be looking at chest expansion. First, I'll inspect. Inspection is normal. Now I'll be using the butterfly method in their back. Can you breathe in? Can you breathe in? Can you breathe in this kind of motion? So my hands expand at equal rates, showing that chest expansion is normal. Range of motion in the upper extremities. Can you do this? Can you do this? Can you raise it up? Can you raise it here? And then can you go in circular motions? And the patient was able to repeat everything on their own without any help. Next, I'll be checking for edema. There is no edema or warmth in the upper extremities. Now I'll be checking the deep tendon reflexes. Using my hammer, I'll use the sharp end. I'll hit the bicep. There was a reflex. I'll hit the tricep. There was a reflex, and now I'll be switching the hammer and using it to hit the brachioradialis. And there was a reflex. Now I'll be checking the cap refill on the upper extremities. And it is a +2 showing good circulatory system. Now I'll be assessing the heart using my stethoscope. So here is the apical pulse. And this is where S2 is greater than S1. I'm sorry, aortic pulse. This is where S2 is greater than S1. Now I'll be listening to the second one, which is the pulmonic, which is S2 is greater than S1 as as well. Now I'll be switching it and using the bell. And this is where herbs is. This is where it's equal. Now I'll be checking the tricuspid. This is where S1 is greater than S2. Now I'll be checking the apical. Using, not the bell, the diaphragm. And you listen to this for 60 seconds. Okay, so pulse is 80, which is within normal range. Now I'll be checking breath sounds using my stethoscope. Can you breathe in every time I move my stethoscope? Thank you. So now I'll be checking lateral sides by making them raise their arms. Breathe in and out. Breathe in and out. So now I'll be doing the exact same thing on the posterior side. Can you raise your arm? Can you raise your arm? So now I've heard the breath sounds. They are regular and they have no gallops or S3 or S4 sounds. Now I'll be checking the abdomen. Will you lay down for me? Thank you. Starting at the lower right quadrant, I'm going to first inspect the lower left, the uppers. They look okay. They don't look distended. Now I'll be auscultating them. Starting at the lower right, using the diaphragm. 60 seconds, 60 seconds, 60 seconds, 60 seconds. They sound active and normal. Now I'll be percussing. Using my dominant hand on my middle finger. And it's tympanic and normal. Now I'll be palpating, starting on the lower right, 1 centimeter deep. There are no masses, and there is no distension. Now I'll be auscultating the aorta of the stomach. And then I'll be auscultating, using the belly. And then I'll be auscultating the renal. And then I'll be auscultating the iliac. And then I'll be auscultating the femoral. So there are no bruits, showing that the arteries are not occluded. Now I'll be looking at the lower extremities. Can you please sit up for me? First, I'll be checking for the range of motion. So can you put your knees up like this for me? Can you move against my resistance? Can you flex your feet upwards and move against my resistance? Yes. And now I'll be looking at their deep tendon reflexes, which is the patellar reflex. I'll be using the sharp end. And there was a reflex, so that is normal. Now I will be checking the pulses. This is the pedal pulse, which is +2 bilaterally, which is a good finding. And then I'll be checking the popliteal, which is a +2 bilaterally, which is normal as well. Now I'll be checking for edema. There is no warmth and there is no swelling, so there should not be any edema. Next, I'll be checking for cap refill. Pressing on the nails, blood return is lower than 3. Now I'll be ending my physical assessment because everything was done. So thank you so much for your help and your patience.